ideally we should have in the baby warmer. You want to have your NeoT, you want to have a suction, you want to have your pulse ox, you want to have your electrodes, and then of course your temperature probe. And if you do have it, you want your temperature probe sticker, which is either a bear or a duck, but you can use this one. Ideally, you also want to have your thermal mattress and your baby poncho. Just in case you do have that baby that's less than 32 weeks, we want to have that ready to go. All right, so that's all the stuff that you need in here. Now what I'm going to do is also show you the kangaroo bag that you have here for less than 6 kilos. And then we have our resources, our NRP in case you forget. We have how to use the warmer and also another algorithm for NRP, okay? So what I'm gonna do now is show you how to use the baby warmer. To first start, here is your on button. You just flip it on. And now you wait. If it doesn't go on like it just did, we're gonna turn it off, and there's a button. Kathy, come with me to the back of the baby warmer. So there's a button back here. Is this on or off? It should be on. Okay, now we'll go back and hit that button. As you can see, now the baby warmer works. If you should always have this back button on, if it's off, that's exactly what will happen. So now that the baby warmer is on, you just need to let it sit for a little bit to start. And this is why if you have a hot truck coming in or a woman in the waiting room saying that she's anticipating labor, you want to get this bad boy on fast, because you don't want to put a baby on here because it's cold and it'll lose heat. So now that the baby warmer is on, the first thing that you see here, it says admit baby. So we're going to hit admit baby, and we're going to hit this nice on button up to 100. Okay, so while this is warming up, we want to make sure we have all the items necessary. In addition, we want to think about and ask the questions: how old is this baby? Just the gestational age. Is it a 32 weeker and we need to have our, again, baby poncho and our warming blanket or mattress? Or is it a term baby? Then we want to ask, you know, is the fluid clear if they're delivering? You know, is the fluid clear? Is it cloudy? Amniotic fluid? Is it meconium? And then you want to ask if there's any risk factors. Does the mom have diabetes, or are they like, oh, hey man, what's up, you know, on drugs or something? So again, you want to ask those pertinent questions. If they're coming in emergently and they're delivering via EMS and we don't have that information, you definitely just want to make sure that this is on 100%. You want to make sure that your T-piece is set up. And how you do that is it's connected here. On most warmers, I do have it at 10 liters per minute. That's your pressure. And you want it at 21%. Okay? And that's ready to go. To check it, you have your T-piece. So you're gonna go to check it, you're gonna go from back to front. I'm gonna make sure that this is on low suction or low pressure. It's in the green. And then I'm gonna follow it up to here. I'm gonna put my red piece on here and I'm gonna push, and it should go between 5 and 10. Okay, and if it does, you're great, and then you can put your mask on, and then this is ready to go. Okay, so that's pretty much how you have to make sure it's set up and ready to go. Now if a baby comes and it's delivered, the first thing that you're gonna do is you're gonna put this in baby mode. Okay, and you can leave the temperature at 36.5, so baby mode. You're gonna turn on your SpO2, and then once the baby's here and connected, you're gonna hit your timer. This is your APGAR timer, okay? So, and I have these little cards to show you the scoring of your APGAR. At 1 and 5 minutes, you're doing your APGAR. You're checking appearance, you're checking your pulse, you're checking if they're moving, their activity, their respirations. At 1 and 5 minutes, there's the most important thing, your silence button. Okay, so that is how you do your timer to turn it on for your APGARs. The other thing is if you do have a stable baby, you can weigh the baby, right? So the first thing you're going to do is dry the baby, warm the baby, stimulate the baby, make sure that they're okay, right? And then if it's a 38-term baby, you can weigh them. So you're going to go to the menu button, you're going to hit menu, you're going to hit scale, and you're going to hit weigh. Okay, it says lift, it's leveling bed. It says lift baby, so I'm gonna pretend that this warmer is my baby. I'm lifting baby, I'm holding baby, and I'm replacing baby. And there you go. Our baby is 1670 grams. You hit accept, and then I could change it to ounces. So 3 pounds, 11 ounces is your baby girl. Congratulations. All right. So if all is good, we dried, we warmed, maybe they need a little suction. Again, you squeeze and then to get it out, and then we're good. Welcome back, guys. So our baby's here. We realized that the heart rate is less than 100. So immediately I'm grabbing my T-piece. I checked it, and I'm gonna start putting the mask on, and I'm gonna hold and do 1 and 2 and 3. Breathe, 1 and 2 and 3. Breathe, 1 and 2 and 3. Breathe, 1 and 2 and 3. I'm going to do that for 60 seconds. After 60 seconds, I'm going to take the mask off. I could put a roll under. I'm going to adjust my mask, and I'm going to do it again for 5 breaths. So 1 and 2 and 3. 1, 1 and 2 and 3. 2, 1 and 2 and 3. 3, 1 and 2 and 3. 4, 1 and 2 and 3. 4, 5. All right. So basically what I'm doing is I'm doing this part. I'm doing the Mr. Sopa part. So I adjusted my mask. Now I could suction. And if suctioning doesn't work and I do 5 more breaths, then we're going to do an alternate airway, whether that is an LMA or I'm going to intubate. Okay, and then if we intubate and we still do our 5 breaths and they're still less than 100, that's when we're going to start chest compressions and get the epi. Okay, so hang on, I'm going to get my epi. In the next video, we're going to show you how we're going to draw up our epi and give it. All right, guys, so we intubated our baby. Now that's the only means of doing epi. The heart rate's less than 60. We have our epi. We're gonna open it from the bottom, slide it out like we normally do. Snap, snap, woohoo! Snap, snap, twist, twist, take it off. And then I got my green piece, my Lego. I'm gonna attach my Lego piece and then I'm gonna get a syringe. I tie my syringe on it. We know that we weighed this baby and it was 1 kilo, so we're just gonna draw up 1 cc of epi, and then I'm gonna put it directly in the ET tube, okay? And then after I put my epi in the ET tube, I'm gonna grab my pressure, no flushing. I'm gonna grab a pressure and I'm gonna go back to my 1 and 2 and 3. Breathe, 1 and 2 and 3. Breathe, 1 and 2 and 3. Breathe. Hopefully that brings up your blood pressure, your heart rate greater than 100, and then hopefully transports here and we're getting this baby out of here. If not, then someone needs to do compressions, and then we're gonna coincide with the breathing with the compressions. All right, any questions, just let us know.